Hello, and welcome to the final set of notes for the reproductive system. Today we're going to be covering the uterine or menstrual cycle, fertilization and implantation of the embryo, and then pregnancy and childbirth, as well as at the end talking about ways that the reproductive system changes throughout the life and also ways that people can prevent pregnancy or fertilization. The menstrual cycle has three distinct phases: the menstrual phase, the proliferative stage, and the secretory stage. The menstrual phase are the days 1 through 5 of the menstrual cycle. What happens to this is the functional layer of the endometrium, remember that is the inside layer that the embryo will eventually implant into, that will nourish the embryo. If there is no fertilization, then the functional layer is sloughed, which means it is shed and it is kicked out of the body through the cervix and vaginal opening. This is what is commonly called the period. During this time, since it is a living layer, a lot of blood is lost as well. Bleeding can occur for 3 to 5 days during this. By day 5, growing ovarian follicles are producing more estrogen. They are preparing for the next pregnancy. The proliferative stage, days 6 through 14. Regeneration of that endometrium layer that was just lost. You also see a rise in the estrogen levels of the body. And at the very end, day 13, 14, 15 somewhere, you get ovulation that occurs and the ovary releases either one or a few eggs. And the final stage, the secretory stage, days 15 through 28. Levels of progesterone rise and increase the body supply or the blood supply to the endometrium. This allows the endometrium to increase in size and ready for implantation. And if there was a fertilized egg, it will implant into the endometrium, and the endometrium will feed the embryo and keep nourishing it as it develops. If there was no fertilization, we go back to the menstrual phase and we continue the cycle all over again for the next month. As I said, if fertilization does occur, the embryo produces a hormone that causes the corpus luteum, which hopefully you will remember is the series of cells surrounding that oocyte, that immature egg, to continue producing those hormones to maintain the pregnancy, nourish the embryo. If fertilization does not occur, the corpus luteum will degenerate and dissolve and be broken down as luteinizing hormone blood levels decrease. Here's a graph that shows the levels of luteinizing and follicle-stimulating hormones. You'll notice about mid-graph, about days 13 to 15, you see a very large spike in both of these hormones, and then a drop after the hormones, after the ovulation occurs. Remember, the oocyte is only viable for a few hours, a day or two, in the fallopian tubes. So you do not have high amounts of those hormones in the body if you do not get the fertilization. So this shows kind of what the corpus luteum looks like. You have the primary follicle, secondary follicle, vesicular follicle. That's the follicular phase. During ovulation, you release that oocyte. If you do not get fertilization, the corpus luteum will then degenerate and eventually dissolve, and you start the cycle over again. And here are fluctuations of hormones. The high estrogen levels are also responsible for the luteinizing hormone and the follicle stimulating hormone surge that you saw in the graph 2 slides ago. Let's talk about some of those hormones. Estrogens are produced by the follicle cells. These are directly related to the secondary sex characteristics, such as enlargement of the accessory organs of the female reproductive system, development of breasts, appearance of axillary and pubic hair, increase in fat beneath the skin, particularly in the hips and the breasts, since as you increase these accessory organs, a little bit more fat will help maintain heat, water levels, allow a little bit more padding and protection for those, as well as increasing the fat around the breast area also helps in enlargement of the breasts and development of the breasts. You also have widening and lightening of the pelvis to allow not as much weight to be carried, and also widening to allow eventual childbirth. And then the onset of menses, the menstrual cycle itself, and ovulation and all the things that come with that. You also get progesterone. This is the hormone that is directly produced by that corpus luteum. It continues until the luteinizing hormone diminishes in the blood. Once that hormone diminishes, corpus luteum does not produce the progesterone anymore. It does not contribute to the appearance of secondary sex characteristics. What it does is it helps maintain the pregnancy, helps once that implants into the wall of the uterus, helps maintain that in the wall of the uterus, and helps maintain the pregnancy and the embryo to keep developing into an eventual fetus after a couple months. It also is directly related to milk production in the breasts. So if you maintain that pregnancy, the corpus luteum will continue to produce the progesterone, which will continue breast preparation for eventual milk production. Of course, if you are not pregnant, you do not need to produce milk, so you do not have the progesterone preparing for milk production. Let's talk a little bit about milk production, mammary glands, and then the breasts themselves. Mammary glands are present in both sexes, but they only function, or they should only function, in females. They're a modified sweat gland. You do have some males that have minor function. However, the fluid produced in male mammary glands, since they do not have anywhere near the levels of the progesterone that females have, since obviously they do not have oocytes and ovaries to produce the progesterone, the fluid that males would produce, if they were able to, would be nothing more than pretty much sweat. Their function of the mammary glands in the females is to produce milk. They're stimulated by sex hormones, mostly estrogens, mainly also the progesterone, to increase in size. anatomy of the mammary glands, which are also anatomy of much of the breast as well. You have the areola, which is the central pigmented area, the nipple, protruding central area of the areola, which eventually the child will be able to get milk out of. Internal structures that radiate around the nipple are the lobes and the lobules. Lobules are located within each lobe and contain clusters of the alveolar glands. The alveolar glands are what are directly responsible for producing milk. And the lactiferous ducts. These connect the alveolar glands to the nipple. So working inside to outside, you have all this yellow area, which is fat contained within the breast. Then you have these areolar ducts, and you have the lobules, the lactiferous ducts, all producing milk and leading outwards, ending at the nipple, which then the child is able to get milk out of during production. Is there anything else I did not cover? Alveolar glands leading to lobules, leading to the lobes and the nipples. Nope. Here's the same thing, shows also generally where these are also in relation to the ribs. So if you find the first rib, which is just below your collarbone, you have breast normally go from about the second rib to about the sixth rib. So you have that 4 or 5 rib area that you find all these milk producing glands, the mammary glands. However, they also are prone to getting cancers. So it is important, whoops, I accidentally flipped it. It is important that once you hit 40, every 2 years, you should get a mammography, a mammogram to check for breast cancer. And what happens during a mammogram is that you take the breast, the mammary glands, and all the area around it, and you squish it down so that all the tissue is flattened out, and then you are able to scan for any irregularity in the appearance of the tissue. Recommended every 2 years for women between 40 and 50. And once you hit 50, you should probably get it every year after that, especially if your family has had a history of breast cancer among all the family members. So here's generally what a mammogram looks like. You have this machine that is able to press the tissue of the breast and then film it, scan the tissue. Shows here, this is what the normal breast area should look like. You have the skin in the dark blue and then the mammary glands in the light blue. If you have an odd look to that, then that means there's extra tissue growth there, and that is sometimes a sign of cancer or excessive tissue growth, whether malignant or benign. All right, let's get back to the oocyte and the sperm. During ovulation, the oocyte is released, and it is released into the fallopian tubes, which is the site of fertilization. If it is fertilized, That is called a pregnancy. Time of fertilization until the birth of the child. The conceptus is the name of the developing offspring. Normally we refer to it in two different stages. In the first 2 months, you have the embryo. After the first 2 months, you have what we call the fetus. The reason we have a difference between embryo and fetus is the embryo does not have all the organ systems of the body. Those are developed at different times throughout the first 2 months of the developing of the conceptus. Starting in week 9, during most pregnancies, at this point the fetus has at least the basics of all the organ systems in the body. So from that point on, we refer to it as a fetus because it is anatomically very similar to a child and an adult human in that it has all the different organ systems. The gestation period is the date of the mother's last period until the birth. Approximately 280 days, around 36, 37 weeks, around 9 months. So this shows you size of the child. The human egg cell is the largest cell in the human body. If you were to take a pin or a needle and very carefully put it into a piece of paper, just make a little pin prick, that is the actual size of the human egg. It is the only human cell that can be seen with the naked eye. After 3 weeks, the embryo is about 3 millimeters thick. 5 weeks, you're at about 10 millimeters, and once you cross that embryo to fetus stage, at about that 8 to 9 weeks, you are a little over 20 millimeters, a little over 2 centimeters. And once you hit the 3 months, 12-week fetus, you're at about 9 centimeters. But first, before we get to any of that, we have to combine the egg and the sperm. This is done through fertilization. Once ovulation happens, the oocyte is viable for 12 to 24 hours, and sperm are viable from 24 to 48 hours after ejaculation happens. For fertilization to occur, the sperm must be ejaculated no more than 2 days before ovulation and no later than 24 hours after, which means in almost every single case, there are only 3 days that pregnancy can occur out of the month. Sperm cells must then make their way to the uterine tube for fertilization to be possible. When the sperm reaches the oocyte, enzymes break down the follicle cells of the corona radiata around the oocyte. So this corona, wonderful time to be having this video, this corona, which means crown, is a special layer around the egg cell that protects it, but also is very, very tough for things to get into. So when the sperm reaches it, enzymes within the sperm break down the cells of the corona radiata. Once that path is cleared, sperm undergo an acrosomal reaction, which is the membranes break down and the enzymes digest holes in the oocyte membrane. The membrane receptors on an oocyte pull in the head of the first sperm cell to make contact. Once that first sperm cell makes it in, the egg takes further actions to make sure that no other sperm are able to make it. Like I said, membrane of the oocyte does not permit a second sperm head to enter. This is done through several different ways, one of them being adding an extra layer of protection, as well as spreading a, for lack of a better word, foam-like chemical that surrounds the sperm and hardens to trap any sperm trying to make it in where they're at, where they will eventually starve to death due to lack of energy. The oocyte, then, remember, we've only gone through one meiotic division. The oocyte then undergoes its second meiotic division to form the ovum, what will actually be fertilized, and a polar body, which is tiny little husk of pretty much nothing. When we think about most mitosis, you have cytokinesis, in which the cytoplasm is divided about 50-50. In meiosis, it's about 25%, 25%, 25%, 25% division in sperm cells. However, in oogenesis, the formation of the egg, the ovum and 3 polar bodies are the result. The ovum itself can get 97 or 98% of all the cytoplasm, and the other 3 polar bodies split the 2 to 3% of the cytoplasm. It is a very uneven division of cytoplasm when you are making a human egg cell, which is also one reason why the human egg cell is so large. It contains almost the cytoplasm of almost 4 entire cells. It is large. Fertilization occurs when the genetic material of the sperm combines with that of the oocyte to form a zygote. So once the genetic material from the 2 haploid cells have joined, from that point on, it is referred to as a zygote or an embryo. Zygote is the first cell of the new individual, the result of sperm and egg fusing. The zygote begins rapid mitotic cell divisions. These divisions can occur in as fast as about 20 minutes or less. Very, very, very quick divisions. In fact, I think after 48 hours, I think that the zygote is 48 cells, if I remember correctly. The zygote stage is in the uterine tube, moving towards the uterus. Rapid series of mitotic divisions is called cleavage because of the splitting of the cytoplasm and the splitting into 2 different cells and then 4 different cells looks as if something has cleaved it into 2, hence the name cleavage. It begins to divide 24 hours after fertilization. It does not happen at the exact moment that the sperm is able to make it in. 3 to 4 days after ovulation, the pre-embryo reaches the uterus and floats freely for about 2 to 3 days. It does not immediately attach to the walls of the uterus. Finally, about 7 days after ovulation, you get the blastocyst stage. The embryo finally implants in the endometrium, which is why you don't have the shedding of the endometrium directly after you have ovulation. It's about 2 weeks from ovulation to when you start your period. For this reason of, once you get fertilization, the egg does not immediately attach to the uterine wall. So here's a handy little diagram. We'll go through it one by one. So first, we have ovulation here. We have released the egg. The egg cell then is taken in by the fimbriae and pushed down the tube, down the fallopian tube. At some point, hopefully, it is fertilized with the sperm. Sperm meets and enters the egg, and you form the zygote, that first fertilized egg. And then it is pushed down the fallopian tube over the next couple of days. Divides very rapidly until finally we get the blastocyst when it enters into the uterus, and after about 7 days, the blastocyst implants into the endometrium, and we can start the development of the embryo and the fetus. Embryo is time from fertilization until week 8. The morula is the 16-cell stage, and the blastocyst is a hollow ball containing about 100 cells. If everything divides by 2 evenly, it will probably have 96 cells, as I believe that is the where it would naturally go. No, it would not actually, because it go from 64 to 128, somewhere between 80 and 120, which is about 100 cells. Fetus is week 9. Embryo first undergoes division without general growth. You take that and you just keep dividing. However, you are not making more cytoplasm. So while it does grow a little bit, you don't have doubling the size every time you divide. Eventually, the embryo floats freely in the uterus and will attach to the endometrium after about 7 days after ovulation. Once we get to the 100-cell stage, it is called the blastocyst, and it secretes human chorionic gonadotropin to induce the corpus luteum to continue producing those hormones. It's pretty much sending a letter back home where it came from saying, hey, continue sending those hormones. I've been fertilized, I've implanted into the uterine wall, please keep sending those hormones so that I can continue to live. That's important to me, that I continue to live. Primary germ layers. As with everything, ecto is outside, meso is inside, and ecto is outside, meso is middle, endo is inside. These are important layers because they will determine, each of these layers becomes a distinct part of your body later on. Ectoderm becomes your nervous system and the epidermis of your skin. Since ecto is the outside, it becomes what is close to the outside of your body, the outside of your skin, and the nerves, since the nerves often, with pressure sensors, are attached to the outside of your skin. The endoderm become your mucosa, all the mucus layers of your body, while also becoming your glands. And the mesoderm, the inside, everything else in your body develops from the mesoderm. Here is kind of a picture, but it's very difficult to read and see with all these lines, so we're not worried about it. It will be very important in college. We're not super worried about it right now. After implantation, you develop the amniotic sac and the umbilical cord. This is where you get still being attached to that endoderm that allows you to continue to receive stuff from mom's body as you develop. Functions of this placenta that the umbilical cord is attached to. Forms a barrier between mother and embryo. However, blood is not exchanged. If you will remember when we talked about blood, one problem is the Rh disease, hemolytic disease of the newborn, but that only happens if 1, there's a blood transfusion somewhere, or 2, during childbirth when child blood and mom blood are mixed, because before that point, blood is not exchanged between the embryo and the mother. The placenta also delivers nutrients and oxygen from the blood of the mother into the embryo, removes waste from embryonic blood out of the embryo and the fetus into the mother's blood that then will be gotten rid of most likely in the urine. And it also becomes an endocrine organ and takes over for the corpus luteum, because those things can't go on producing hormones forever. So by about the time it becomes a fetus, the placenta has taken over the role of the corpus luteum by producing estrogen, progesterone, and other hormones that will help it develop. By the time it becomes a fetus, all organ systems have been formed. The activities of the fetus are growth and specialization. Once you have those organ systems formed, then you go in and you form the specific parts, such as at the end of 8 weeks, you have something that will become your heart, but it's not super developed. It might just be blood vessel that has a little bit extra muscle around it. However, from the end of 8 weeks up to birth, that will then specialize, and you will get all the chambers of the heart, all the different nodes, all the different pacemaking cells, all these different things that will then go on to divide into the aorta and the arteries, and then down into the arterioles, into the capillaries. The main part of the fetus is specialization, developing all those small parts that are not immediately found in the embryo, because it has to get larger so that you can start specializing all the little things. This stage obviously has tremendous growth and a change in appearance. From a single cell to a human, the appearance change is vast, but because it is gaining in size, it is able to change that appearance very easily. Here are pictures of fetuses. You'll notice, even from the left to the right, vast change. Now comes the fun part. We've talked about the baby, but how does pregnancy affect mom? Anatomical changes. Obviously, the baby's getting bigger, so you have enlargement of the uterus. As the baby gets bigger, the area that it is developing in will get bigger. Accentuated lumbar curvature, lordosis. As it gets bigger, it affects the curvature of the spine, which often causes change in the curvature of the spine and how the mother must carry herself to offset that. You also get relaxation of the pelvic ligaments due to the production of relaxin. Allows that uterus to change and to grow larger. So, before conception, this is about the general size of the uterus in the mother. After about 4 months, the uterus has grown a little bit larger. Fundus is about halfway between the pubic symphysis and the umbilicus, about halfway between the pelvic bones and the umbilical cord. 7 months in, fundus has well passed the umbilical cord, and by about 9 months, the fundus reaches the xiphoid process, which is the base of your sternum. So it is reaching up into and touching the very base of your sternum at 9 months. It has grown quite a bit. Physiological changes. It affects a lot of organ systems. Gastrointestinal system. Morning sickness is common due to all these changes in the hormones. Your body has all these different hormones running through it. Doesn't always like that, makes you feel weird. Heartburn is common because as you are crowding those organs, especially the stomach and esophagus. It affects the acid, and it affects the connection between the esophagus and the stomach. That valve, sometimes you get backwash, which leads to heartburn. Constipation is also caused because it starts squishing into the digestive tract. You have problems relieving yourself of all the fecal matter. Urinary system. You're producing a kid. You have much more body mass. Therefore, your kidneys have an additional burden and will produce more urine. But it seems also kind of counterproductive. While you're producing more, the larger you get, the more urine you produce, but the larger you get, the more it presses on the bladder, causing incontinence. Much more frequent urination. So you're producing more urine as well as going more often. Or sometimes not at all, depending on how well how it is pressing. It might also be pressing on parts of the urethra and causing problems with going. Respiratory system. Your nasal passages will become congested and swollen. Might feel constant pressure in your nose. Vital capacity and respiratory rate will increase, and difficulty breathing will occur later as that developing baby in the uterus presses farther and farther up. As it approaches the sternum in the xiphoid process, it will also start pressing on the diaphragm, which will lead to problems in breathing. Blood volume will increase by 25 to 40%. Blood pressure will also increase because as the volume increases, you're not growing a lot of more blood vessels, so as you increase what's inside those vessels, that pressure will also increase. Varicose veins are also common at this time. Finally, eventually, it's time to get rid of the little demon spawn inside of your body. We call this childbirth. Once it is time to give birth, you go into labor, a series of events that will eventually expel the infant from the uterus. These normally manifest in rhythmic, expulsive contractions because you want to squeeze the baby out of your body. So you contract to squeeze it out of the body. Braxton Hicks contractions are weak, irregular uterine contractions. These are false labor. It could just be your body is wanting to move that baby around. It doesn't like where the baby is. As it gets larger, the uterus can only expand so much. So you have contractions to move that baby around into a better position, as well as also moving the baby around, eventually leading to going into labor. But your body could prepare for a week or more before actually going into labor of just moving that baby into a better position for the eventual labor. Initiation of labor. Estrogen levels will rise significantly. The contractions will begin. Placenta will release the prostaglandins. Oxytocin will be released by the pituitary gland, and the combinations of these will produce contractions. So, first, the baby will move deeper into the mother's birth canal. After these contractions that we've talked about before, to move the baby, because you want head first. Once you have moved it to there, then it will move deeper into the birth canal. You will start entering the cervix. Pressure receptors in the cervix will recognize the head is pushing into us. That will excite them. Sends an impulse to the hypothalamus. Hypothalamus will send an impulse to the pituitary, where the oxytocin is stored, and the pituitary will release the oxytocin. Once the oxytocin reaches the uterus, it will respond by contracting more vigorously, which moves the baby deeper into the canal, which reactivates the pressor receptors to then ask the hypothalamus to tell the pituitary to send more. As you saw in the bottom right, it is a positive feedback mechanism. Once you send that signal, the effect you get from the signal will cause the effect to become stronger as it is resent again and again and again. Childbirth and blood clotting are the two positive feedback mechanisms in the body that once you get the response, it gets stronger and stronger and stronger until you get the desired result. You are not trying to maintain the status quo and bring it back to neutral. You want more of the same. Stages of labor. Dilation. Full dilation is 10 centimeters, which is, not knowing exactly how big it is, probably about 2/3 the length of your hand, half the length of your hand somewhere. Uterine contractions begin and increase. The amnion ruptures. We call this the amniotic fluid. When it ruptures, the fluid will leave the cervix and the vaginal canal, and we call that a woman's water has broken. This is the longest stage at 6 to 12 hours. This is you getting ready for childbirth. This is your body telling you, we're moving everything into position. Get ready for birth, because once we start these contractions, the baby is coming. At this point, it has moved into the cervix, and the body is telling you, we are ready to get this thing out. Expulsion. Infant passes through the cervix and vaginal canal. Can last as long as 2 hours, but is typically 50 minutes in the first birth and 20 minutes in subsequent births. Normal delivery is vertex position, head first. If you are flipped around, that is called breech presentation. And until the last 20, 30 years, breech position was very, very dangerous and would often lead to death of the child. Or, more often than not, need for a C-section. In which, if you give birth to the child, it's not going to come out well and it could be dangerous, so we will just cut open the abdomen and then cut open the uterus and pull him out of the uterus instead of passing him through the cervix and the vaginal canal. Expulsion, push the baby out of that vaginal canal. Placental stage, once the baby has been born, once you have pushed that baby out, you deliver the placenta, the afterbirth, usually within 15 to 20 minutes after the baby is born. The afterbirth is officially placenta and all the attached fetal membranes. All placental fragments should be removed to avoid postpartum bleeding. You don't want bleeding after you have delivered the baby. You also don't want fragments left in there because your body is done with them. They will start to rot, and that could cause infection. So once you birth the baby, 15, 20 minutes later, hopefully the placenta will follow. Gender is determined at fertilization. Mom can only give an X chromosome. It all depends on what sperm penetrates. If the sperm carries an X chromosome, it will become a female. If the sperm carries a Y chromosome, it will become a male. However, gonads and the genitals do not begin to form until the 8th week. The presence of testosterone determines whether male or female structures will form. If you have testosterone, the body will start to form male structures. However, you do not have to have estrogen. If you have a lack of testosterone, if no testosterone is introduced into the system, the body will default to female. They have done experiments. I don't know if they've done it on humans, but I believe they have done it on other primates, on monkeys and gorillas, where all they will do is go in and before it forms, they will turn off the gene that releases the testosterone. And even though the baby is XY, genetically a male, it will develop feminine features because the testosterone was not released at the time that it's needed. It is a very tight window. The gonads begin to form in the 8th week, and by the end of the 9th, beginning of the 10th week, if testosterone has not been released into the body, it will develop into a physiological female. Reproductive system organs do not function until puberty, usually between the ages of 10 and 15. Girls go through puberty before males. Males normally around the age of 13, and it's seen enlargement of the testes and scrotum. Females, the development of breasts, normally around age 11, as well as the menarche, which is a fancy name for your first period. Let's go to the other end. Menopause. A whole year has passed without menstruation. That means your ovaries stop functioning as an endocrine organ. It stops releasing LH and progesterone, and your ability to bear children ends. There is no equivalent of menopause in males. Males will continue to release sperm until the day that they die. However, there is a steady decline in testosterone. So you do not develop sperm as well later on into your life. Therefore, it is less common for males to produce children. 50s and 60s, it is normally not super uncommon. However, once you hit the 70s and 80s, it is less and less and less common to produce viable children because you release less testosterone. You do not develop as many sperm. The genetics of the testes start wearing down, so the sperm that you produce are not as viable. However, you will continue producing sperm until you die. Let's say you don't want to get pregnant. That is called contraception or birth control. The most common used contraceptive is the pill, the birth control pill. This releases a relatively constant supply of the ovarian hormones. This tricks your body into thinking that you are already pregnant, and your body thinks, I do not need to. I'm already pregnant. I do not need to develop another oocyte. Therefore, follicles do not mature. Ovulation does not occur, and menstrual flow is reduced. However, if you are on the pill, you will still have your menstrual cycle. You will still slough off the endometrium. because the pill is built as 3 weeks of this hormone with 1 week of a hormone control, a placebo. You take the pill, but it's no more than like a sugar pill. Therefore, your body does not receive that hormone, and it says, oh, it's about time to slough off the endometrium anyway. Okay, we will get rid of the endometrium here. And it sheds the lining of the uterus. And then when it is ready to think, well, maybe I should look at starting ovulation again, you get back on the hormone pill and it says, nope, I guess I'm already pregnant. No need to ovulate this cycle. You also then have the morning after pill, taken within 3 days of unprotected sex. It disrupts normal hormonal signals to the point that fertilization is prevented. Since the sperm are viable for up to 48 hours, it does not have to be taken at the exact moment of sexual intercourse. It can be taken within 2 or 3 days of the unprotected sex, because it will prevent that fertilization from happening. However, if it has already happened, the morning after pill will not prevent anything else. Other hormonal birth devices cause cervical mucus to thicken. You thicken the cervical mucus, it makes it much harder for the blastocyst and the zygote to implant into the uterine wall. You also then have IUDs, intrauterine devices. These are plastic or metal devices that are inserted directly into the uterus. This then releases a hormone that prevents implantation of the fertilized egg. It'll get fertilized, it'll develop into a zygote, it'll develop into a blastocyst, and it will free roam around the uterus, but it cannot then implant into the wall, so it then gets released during the menstrual cycle, and you do not have a developing embryo within the uterine wall. Or if you're looking for, you want no more children, you can go with sterilization, which you have tubes being tied, the tubal ligation, where you cut or cauterize the fallopian tubes, or a vasectomy, where you cut or cauterize the ductus deferens, the vas deferens. If you cut the fallopian tubes, that prevents the egg from reaching the uterus as well as the sperm from reaching the egg. And if you cut the vas deferens, it prevents the sperm from being able to reach the penis during ejaculation. Therefore, any ejaculation that happens would be all the fluid from the accessory organs, but not contain any sperm. We then have coitus interruptus, which is often called the pull-out method, which is withdrawal of the penis prior to ejaculation. If sperm are not introduced to the vaginal canal, they cannot meet the egg and fertilization cannot happen. Or if you just want to keep track of your temperature, keep track of different levels in your body, that is called fertility or rhythm awareness. Just avoiding intercourse during that 3 days that it is possible that you could become pregnant. There are then also several different barrier methods where you just prevent sperm and the egg from meeting, such as diaphragms, cervical caps, condoms, both male and female, spermicidal foams, which decrease the viability of the sperm in the most drastic way possible by killing them. You then have gels and sponges to absorb the reproductive cells as well. Once fertilization does happen and implantation happens and it is developing in the uterus, the only ways that you can get rid of the baby are through abortion, which is termination of the pregnancy. However, oftentimes the body will spontaneously abort for one reason or another, while the body is monitoring the pregnancy. It looks at it and says, something's not right, and it will end the pregnancy on its own. This frequently occurs before a woman even knows she is pregnant. This can happen within the first week or two before she would have missed her first period. So many different pregnancies. I have seen some figures that say as many as 60 to 70% of pregnancies are miscarried, and many of them end before a woman even knows she is pregnant. There's also the traditional abortion that you hear about of ending of the pregnancy during the late embryo or early fetal stage. I believe it is illegal to end a pregnancy after 12 weeks in the United States, if I remember correctly. So you would have to have an abortion before 12 weeks. If you want to take a pill for it, they do make an abortion pill that induces the miscarriage during the first 7 weeks of pregnancy. However, by the time it reaches the fetal stage, the abortion pill would not work. Here is a chart that shows here are all the different events from fertilization to, or from production of the cells to birth, and at what stage you would have to do these. One that we didn't talk about, which is implied, but I guess we will still talk about it. Abstinence. If you refrain from having sexual intercourse, you cannot get pregnant. So the most sure way of avoiding pregnancy is abstinence. If you do not have sex, you cannot get pregnant. However, all these others are ways for sexual intercourse to happen and to avoid the eventual development of a child. And I believe, yep, that is it. These are just examples of the different. So, with that, we will end this section of notes on reproduction.